So the eligibility criteria, patients had to have received at least 3 prior regimens. They had to have relapsed on or within 60 days of their last regimen, and they had to have received a previous proteasome inhibitor and immunomodulatory agent. Alternatively, you could be eligible for the study if you had documented proteasome inhibitor and immunomodulatory drug refractory disease and had also relapsed on or within 60 days of your last treatment regimen, regardless of the number of prior regimens that you had received. And when you look at the baseline characteristics of the patients and their disease, what you quickly learn is that 97% of the patients in the study did in fact have disease that was refractory to their last regimen. 95% of patients had what we call double refractory disease. In other words, they were refractory to both their last proteasome inhibitor-based therapy as well as their last immunomodulatory-based therapy, which in most cases was a lenalidomide-based therapy. The other thing that's important to recognize is the fact that there were a lot of patients on the study that had received previous pomalidomide. About half of the patients had received previous carfilzomib-based therapy, and there was a respectable proportion of patients that had disease that was refractory to those agents as well. So in this particular study, we're talking about triple refractory disease, and we're talking about quadruple refractory disease. So this is a patient population clearly with an unmet need. And what was striking about the study is that the overall response rate was 29%. Not only that, but we saw responses, deep responses, including stringent complete responses, as well as very good partial responses, something that you would not typically expect to see for patients in this particular situation. The responses were seen fairly early, so time to first response was approximately 1 month. You did see deepening of responses over the course of therapy, so patients that maybe started off in PR, go to VGPR, and then to SCR, for example. The duration of response, the median duration of response was 7.6 months, which is also very respectable. When you looked at patients, with regards to kind of high-risk biology, so for example, if you looked at patients who had high-risk cytogenetics, if you looked at patients who had extramedullary disease, both are be considered very bad prognostic scenarios, the response rate was in the 25 to 30% range approximately. Additionally, when you broke it down by previous therapies and resistance to previous therapies, the response rate was approximately 25 to 30%, whether you were double refractory, whether you were triple refractory, whether you were quadruple refractory. So the important thing of that, is that it really speaks to the fact, that this really is a novel agent, with a novel mechanism of action that is agnostic not only to the typical high-risk biologic features of multiple myeloma, but to resistance patterns, to existing therapeutics